Welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, we will go through 20 NCLEX practical nurse multiple choice questions and answers. If you like this video, please share it with your friends. Let's begin.
41. The nurse is caring for a client with a diagnosis of hyperparathyroidism. Laboratory studies are performed, and the serum calcium level is 12.0 mg/dl. Based on this laboratory value, the nurse should take which action? 1. Document the value in the client's record. 2. Inform the registered nurse of the laboratory value. 3. Place the laboratory result form in the client's record. 4. Reassure the client that the laboratory result is normal. Answer. 2. Rationale. The normal serum calcium level ranges from 8.6 to 10.0 mg/dl. The client is experiencing hypercalcemia, and the nurse would inform the registered nurse of the laboratory value. Because the client is experiencing hypercalcemia, the remaining options are incorrect actions. 42. The nurse reviews the client's serum calcium level and notes that the level is 8.0 mg/dl. The nurse understands that which condition would cause this serum calcium level? 1. Prolonged bed rest. 2. Adrenal insufficiency. 3. Hyperparathyroidism. 4. Excessive ingestion of vitamin D. Answer. 1. Rationale. The normal serum calcium level is 8.6 to 10.0 mg/dl. A client with a serum calcium level of 8.0 mg/dl is experiencing hypocalcemia. The excessive ingestion of vitamin D, adrenal insufficiency, and hyperparathyroidism are causative factors associated with hypercalcemia. Although immobilization can initially cause hypercalcemia, the long-term effect of prolonged bed rest is hypocalcemia. 43. The nurse is caring for a client with a suspected diagnosis of hypercalcemia. Which signs, symptoms would be an indication of this electrolyte imbalance? 1. Twitching. 2. Positive Trousseau sign. 3. Hyperactive bowel sounds. 4. Generalized muscle weakness. Answer. 4. Rationale. Generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau sign, and hyperactive bowel sounds are signs of hypocalcemia. 44. The nurse is instructing a client on how to decrease the intake of calcium in the diet. The nurse should tell the client that which food item is least likely to contain calcium? 1. Milk. 2. Butter. 3. Spinach. 4. Collard greens. Answer. 2. Rationale. Butter comes from milk fat and does not contain significant amounts of calcium. Milk, spinach, and collard greens are calcium-containing foods and should be avoided by the client on a calcium-restricted diet. 45. The nurse is caring for a client with hyperparathyroidism and notes that the client's serum calcium level is 13 mg/dl. Which prescribed medication should the nurse prepare to assist in administering to the client? 1. Calcium chloride. 2. Calcium gluconate. 3. Calcitonin, miacalcin. 4. Large doses of vitamin D. Answer. 3. Rationale. The normal serum calcium level is 8.6 to 10.0 mg/dl. This client is experiencing hypercalcemia. Calcium gluconate and calcium chloride are medications used for the treatment of tetany, which occurs as a result of acute hypocalcemia. In hypercalcemia, large doses of vitamin D need to be avoided. Calcitonin, a thyroid hormone, decreases the plasma calcium level by inhibiting bone resorption and lowering the serum calcium concentration. 46. A client has the following laboratory values: a pH of 7.55, and CO3, level of 22 mm Hg, and a CO2 of 30 mm Hg. Which action should the nurse take? 1. Perform Allen's test. 2. Prepare the client for dialysis. 3. Administer insulin as prescribed. 4. Encourage the client to slow down breathing. Answer. 4. Rationale. The client is in respiratory alkalosis based on the laboratory results of a high pH and a low CO2 level. Interventions for respiratory alkalosis are the voluntary holding of breath or slowed breathing and the rebreathing of exhaled CO2 by methods such as using a paper bag or a rebreathing mask as prescribed. Performing Allen's test would be incorrect, because the blood specimen has already been drawn, and the laboratory results have been completed. Dialysis and insulin administration are interventions for metabolic acidosis. 47. The nurse is told that the blood gas results indicate a pH of 7.50 and a CO2 of 32 mm Hg. The nurse determines that these results are indicative of which acid-base disturbance? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. Answer. 4. Rationale. The normal pH is 7.35 to 7.45. In a respiratory condition, an opposite relationship will be seen between the pH and the CO2, as is seen in the correct option. In an alkalotic condition, the pH is increased. In an acidotic condition, the pH is decreased, so both metabolic acidosis and respiratory acidosis can be eliminated. Metabolic alkalosis can also be eliminated because both pH and CO3 are increased above normal values in this condition. 48. A client is scheduled for blood to be drawn from the radial artery for an arterial blood gas, ABG, determination. The nurse assists with performing Allen's test before drawing the blood to determine the adequacy of which? 1. Ulnar circulation. 2. Carotid circulation. 3. Femoral circulation. 4. Brachial circulation. Answer. 1. Rationale. Before performing a radial puncture to obtain an arterial specimen for ABGs, Allen's test should be performed to determine adequate ulnar circulation. Failure to assess collateral circulation could result in severe ischemic injury to the hand if damage to the radial artery occurs with arterial puncture. The remaining options are not associated with this test. 49. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation. 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. Answer. 2. Rationale. The loss of gastric fluid via nasogastric suction or vomiting causes a metabolic condition. This also results in an alkalotic condition due to the loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis and respiratory alkalosis, can be easily eliminated. 50. The nurse is caring for a client with severe diarrhea. The nurse monitors the client closely, understanding that this client is at risk for developing which acid-base disorder? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. Answer. 1. Rationale. Intestinal secretions high in bicarbonate may be lost through enteric drainage tubes, ileostomy, or diarrhea. The decreased bicarbonate level creates the actual base deficit of metabolic acidosis. The remaining options are unlikely to occur in a client with severe diarrhea. 51. The nurse is caring for a client with diabetic ketoacidosis and observes that the client is experiencing abnormally deep, regular, rapid respirations. How should a nurse correctly document this observation in the medical record? 1. Apnea observed. 2. Great apnea noted. 3. Cheyne-Stokes demonstrated. 4. Kussmaul's respirations observed. Answer. 4. Rationale. Abnormally deep, regular, and rapid respirations observed in the client with diabetic ketoacidosis are documented as Kussmaul's respirations. In apnea, respirations cease for several seconds. In bradypnea, respirations are regular but abnormally slow. Cheyne-Stokes respirations gradually become more shallow and are followed by periods of apnea, no breathing, with repetition of the pattern. 52. The nurse is caring for a client with a diagnosis of chronic obstructive pulmonary disease, COPD. The nurse should monitor the client for which acid-base imbalance? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. Answer. 3. Rationale. Respiratory acidosis most often occurs as a result of primary defects in the function of the lungs or changes in normal respiratory patterns from secondary problems. Chronic respiratory acidosis is most commonly caused by COPD. Acute respiratory acidosis also occurs in clients with COPD when superimposed respiratory infection or concurrent respiratory disease increases the work of breathing. The remaining options are not likely to occur unless other conditions complicate the COPD. 53. When caring for the following group of clients, who does the nurse determine is at risk for development of metabolic alkalosis? Select all that apply. 1. Client with emphysema. 2. Client who is hyperventilating. 3. Client with chronic kidney disease. 4. Client who has been vomiting for 2 days. 5. Client receiving furosemide, Lasix 40 mg daily. 6. Client admitted with acetyl salicylic acid, aspirin, overdose. Answer. 4, 5. Rationale. Metabolic alkalosis is caused by any condition that creates the acid-base imbalance through either an increase in bases or a deficit of acids, such as the client who has been vomiting for 2 days and the client receiving furosemide daily. Recall that clients with emphysema and hyperventilation are at risk for a respiratory acid-base disturbance. Chronic kidney disease and aspirin overdose will result in metabolic acidosis. 54. The nurse is caring for a client with respiratory insufficiency. The arterial blood gas results indicate a pH of 7.50 and a CO2 of 30 mm Hg, and the nurse is told that the client is experiencing respiratory alkalosis. Which additional laboratory value should a nurse expect to note? 1. A sodium level of 145 mg/L. 2. A potassium level of 3.2 mg/L. 3. A magnesium level of 2.4 mg/dl. 4. A phosphorus level of 4.0 mg/dl. Answer. 2. Rationale. Signs, symptoms of respiratory alkalosis include tachypnea, mental status changes, dizziness, pallor around the mouth, spasms of the muscles of the hands, and hypocalcemia. The remaining options identify normal laboratory results. 55. The registered nurse reviews the results of the arterial blood gases with a licensed practical nurse, L.PN, and tells the L.PN that the client is experiencing respiratory acidosis. The L.PN should expect to note which on the laboratory result report. 1. pH 7.50, CO2 52 mm Hg. 2. pH 7.35, CO2 40 mm Hg. 3. pH 7.25, CO2 50 mm Hg. 4. pH 7.50, CO2 30 mm Hg. Answer. 3. Rationale. The normal pH is 7.35 to 7.45, and the normal CO2 value is 35 to 45 mm Hg. In respiratory acidosis, the pH is down and the CO2 is up. Therefore, the option with the pH of 7.25 and the CO2 of 50 mm Hg is the only option that reflects an acidotic condition. Options with an elevated pH, options 1 and 4, indicate an alkalotic condition. Option 2 identifies normal values for pH and CO2. 56. The nurse is told that the laboratory result for the serum digoxin level is 2.4 nanograms per milliliter. Which action should the nurse take? 1. Withhold the medication. 2. Check the client's last respiratory rate. 3. Record the normal value on the client's flow sheet. 4. Administer the next dose of the medication as scheduled. Answer. 1. Rationale. The normal therapeutic range for digoxin is 0.5 to 2 nanograms per milliliter. A value of 2.4 nanograms per milliliter exceeds the therapeutic range and could be toxic to the client. The nursing action is to hold further doses of digoxin. Because the value is not normal, option 3 can be eliminated. Administration of the next dose would cause the client to become more toxic. Checking the client's respiratory rate is not applicable at this time. 57. A client with atrial fibrillation who is receiving maintenance therapy with warfarin sodium, Coumadin, has a prothrombin time, PT, of 30 seconds. The nurse anticipates that which will be prescribed? 1. Adding a dose of heparin. 2. Increasing the next dose of warfarin sodium. 3. Withholding the next dose of warfarin sodium. 4. Administering the next dose of warfarin sodium. Answer. 3. Rationale. The normal PT is 9.6 to 11.8 seconds for the adult male and 9.5 to 11.3 seconds for the adult female. The goal of oral anticoagulation with warfarin sodium therapy is to achieve a PT at 1.5 to 2 times the laboratory control value. A PT of 30 seconds places the client at risk for bleeding, so the nurse should anticipate that the client would not receive further doses at this time. If the level is too high, the antidote, vitamin K, may be prescribed. The remaining options would make the client even more prone to bleeding. 58. A client having pre-admission testing before surgery had blood drawn for the determination of serum electrolyte levels. The nurse determines that which result warrants a call to the healthcare provider by the nurse. 1. Sodium, 148 mg/L. 2. Chloride, 101 mg/L. 3. Potassium, 3.8 mg/L. 4. Bicarbonate, 26 mg/L. Answer. 1. Rationale. The normal serum electrolyte ranges for adults are as follows: sodium, 135 to 145 mg/L, potassium, 3.5 to 5.0 mg/L, chloride, 98 to 107 mg/L, and bicarbonate, venous, 22 to 29 mg/L. The only abnormal value identified is the serum sodium level. 59. The nurse determines that sodium polystyrene sulfonate, Kegsilate, has been effective in a client if which laboratory result is noted. 1. Serum sodium is 148 mg/L. 2. Serum glucose is 110 mg/dl. 3. Serum chloride is 110 mg/L. 4. Serum potassium is 4.9 mg/L. Answer. 4. Rationale. The normal serum potassium level in the adult is 3.5 to 5.0 mg/L. Sodium polystyrene, Kegsilate, is a medication that is used to treat hypercalcemia. The laboratory values in the remaining options are slightly elevated. In addition, this medication would have no effect on these other electrolytes. 60. A client with a history of cardiac disease is scheduled for a dose of furosemide, Lasix. Which serum potassium level warrants a call to the healthcare provider by the nurse before administering the furosemide? 1. 3.2 mg/L. 2. 3.8 mg/L. 3. 4.2 mg/L. 4. 5.2 mg/L. Answer. 1. Rationale. The normal adult serum potassium level is 3.5 to 5.0 mg/L. A serum potassium level of 3.2 mg/L is the only value that falls below the therapeutic range. Administering furosemide, Lasix, to a client with a low potassium level and a cardiac history could precipitate ventricular dysrhythmias in the client. Even though a result of 5.2 mg, L is high, administration of the furosemide can only assist with excretion of the excess potassium.